And so talk a little bit about what your experience was first of all, learning that your mom had this debilitating disease. And then how did you and your, sibling handle it or family handle it at that time? What was going through your mind? What was going through your brain as you were learning that this thing is I would say taking over your mom's body?
I think that I was witness to what happens particularly in African American culture, which is
Mm,
we won't claim it. We're going to
mm-hmm,
use our faith and move forward. And so as
mm-hmm,
we saw this condition unfolding, there was the turning away from what was happening right before us earlier on until we reached a point where we had a very, very uncharacteristic things happened acutely where we had,
mm,
okay, wait, something is not right.
yeah,
Yes, we can ignore it if you
yeah,
wish. However, I think we need to go to a hospital. And
okay.
so, although there was talk of this condition for my mother, she actually received her diagnosis, I would say again,
Mm,
while I was a resident
yeah.
with my program director of my residency. So it was a very, I lack the word. It was just a very atypical, for lack of better wording, experience to sort of recognize that something was going on, but of course, not really having much medical knowledge, but enough knowledge to know this is going to come back. This is going to come back again. We can't just
Yeah.
dismiss it. I knew that something was going on, and then to sort of go through that process of getting that official diagnosis again, but with understanding.
Mm-hmm.
Um, it was jarring, and to watch the disease unfold was certainly an ongoing challenge. But again, even though it
Yeah.
was a trial, I think that that makes me more effective as a neurologist in a way that if you have not lived that, you would not understand. That's not something that is taught in medical.
Yeah. 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 And, looking back, and I can't really say I understood personally what you were going through, but we felt it, a lot of what you were going through, especially as mom's disease was changing and progressing. We saw a lot of that. But mostly what I did see, Dr. Jessica, is that you got up every day and you were still able to go and care for your patients, and you had this thing going on at home, but you got up every day and you left for work and you came back home and you took care of your patients as if nothing was going on at home. How did you do that? How were you able to do that?
Think, first of all, that wasn't easy. And secondly, I didn't wake up immediately there. It was a process, definitely. And I don't think you get there overnight. If you are a caregiver for someone, it becomes your rhythm. And that's the real challenge, I think, of caregiving is finding your rhythm. Once you find it,
Mm,
it is what it is. And you
yeah.
just you this is your normal, and that's fine. This is your normal. Can I participate when someone has an activity? As long as it's before this time, sure, let's go. But but I gotta get home.
Yeah. Yeah.
It works out.
Yeah. I see how you manage it. So what do you find as one of the biggest misconceptions that families have either about dementia or other debilitating disease?
Think the fear factor of the unknown is the thing that causes diagnoses like dementia or even multiple sclerosis to be jarring and to be traumatic sometimes.
Mm-hmm. Mm-hmm.
And so if you were to tell someone that they have a condition that has the potential to worsen over time and that there are medications that might modify the course of the disease but cannot get rid of it completely, that sounds challenging. But at the same time, it sits better than for me to put a specific label to that because I just described dementia and multiple sclerosis.
Yeah.
But when you hear these terms, all you have is the stigma associated with the term or having never heard the term at all. So I think
Yeah.
the lack of knowledge is the hardest part and the biggest hurdle to be overcome with these
Yeah.
conditions.